Well, about every 34 seconds, someone in the United States has a heart attack. That's according to the American Heart Association.
That's an unbelievable statistic. Every 34 seconds. So Dr. Omer Zuberi is with First Coast Cardiovascular Institute, and he helps people understand what exactly happens during a heart attack and what can be done, more importantly, to prevent this from happening in the first place and how to make sure that we are heart healthy. So thank you for being here, Doctor. We appreciate it.
Thanks for having me.
Let's talk about exactly what is a heart attack. So what is somebody experiencing and what's happening in the body?
Heart attack, also called myocardial infarction, is basically the blood supply to the heart is compromised and it results in damage to the heart muscle tissue. Heart attack is caused by disease entity coronary artery disease. Coronary artery disease, there's fatty plaque buildup inside the coronary arteries. Those plaque can rupture or break open, leading to clot formation on top of them, leading to complete cessation of blood supply to that portion of the heart, leading to damage. If nothing is done in timely fashion, it can lead to life-threatening consequences. It could be permanent damage to the heart muscle, leading to congestive heart failure, or bad heart rhythm problem, leading to sudden cardiac death.
So we said every 34 seconds someone has a heart attack.
Yeah.
So let's talk about the relationship between heart attack and heart disease, and then what is the burden of heart disease on the country?
That's a good question. According to American Heart Association data from 2010, nearly 17.6 million people have coronary heart disease, including 8.5 million having a heart attack and 10.2 million having other manifestation of coronary artery disease like angina pectoris and like that. If you're a male at the age of 40, your lifetime risk of developing coronary artery disease is close to 49%. That's staggering.
Wow.
In addition to that, if you're a woman, your chances of having heart disease is 32% lifetime risk. Coronary artery disease remains #1 cause of mortality in United States, accounting for nearly 1/3 of all death in people aged greater than 35 years. Of course, males are more prone to that than females. The good news is, if you look at the data, there's constant decline in mortality for coronary artery disease in past 4 decades, and it is consistent. This is most likely attributed to life-saving revascularization procedures, as well as advancement in medical therapy for primary and secondary prevention.
So that leads to my next question. What happens when somebody has a heart attack, and what transpires between that and when they actually come to see you? And why is time of the essence, too?
Okay. Time, I cannot emphasize enough, time is crucial. Time is muscle, basically. Most of the hospitals these days are graded and have as their part of quality measures door to balloon time. What that means is time when a heart patient come in contact with the first medical contact to the time the artery is open. And it is recommended the artery should be open within 90 minutes.
Wow. So talk us through that decision-making process. If that's the recommendation that the arteries have to be open within 90 minutes, how does someone know if they need that type of intervention?
That's a good question. As far as the decision-making, what we need to decide is to perform emergent intervention. It is decided based on a simple EKG, which is electrocardiogram. With the technology available these days, EMS can transmit EKG to my iPhone when they see and encounter a patient with chest pain. ER is alerted, I'm alerted, and the whole team, once the decision is made that this is true heart attack, we need to move forward. The whole team is then called in to perform this life-saving procedure.
You know, you hear a lot of people having stents done, right, or having different procedures done. Can you put it into layman's terms what exactly is happening when they come in and they have a procedure with you?
Sure. Percutaneous coronary intervention or coronary angioplasty is the procedure to open heart arteries. The way it works is a small plastic tube called the catheter is inserted from the groin and these days from the wrist as well, and is threaded to the heart artery in question. Then a small flexible metal wire is advanced through that blockage. Next, another small catheter with the balloon-tipped catheter, which is much smaller, is advanced on top of that wire to the portion of the blockage. The balloon is inflated and the artery is open. 70 to 90% of the time these days, coronary interventions are accompanied with stent deployment, and the stent is deployed. It is a metal coil. Basically, it keeps the artery open and also prevent it from re-narrowing. The stent become part of the body, and it is basically the body blood vessel lining covers it up.
Wow, these interventions are so advanced. I just wonder, is there any difference between a patient who, say, has an intervention earlier than someone who maybe ignores the symptoms?
Yeah, the thing is, like, with still all these advancements, 15% of the patient never reach to the hospital, but they die with the event. Out of those who reach the hospital, the success rate of intervention is very high, and most of them make out of the hospital. I cannot emphasize enough how much symptoms are important. Patients should not ignore their heart attack. It usually feels like a pressure, like an elephant sitting on their chest. Sometimes with the radiation to the arm, jaw, they can have profound sweating. If any of these symptoms occur, and especially in elderly and women, they are vague symptoms like indigestion, they should never be avoided. I recommend all the patients to call 911 immediately. Never try to drive by themselves, because that can result in life-threatening arrhythmia. Also, we have, as I described earlier, we have a system in place. We can get the artery open in a timely fashion. The main limiting factor is the patient recognizing the symptom and coming to the hospital and seek medical attention. So those are the things that I really want to emphasize on the patient.
All right.
We need to reduce the total time of the heart attack to have a successful outcome.
Okay. Time is of the essence. Thank you so much, Dr. Zuberi. We appreciate you being here. And also thanks to First Coast Cardiovascular Institute for sponsoring this segment. And remember to know your body, know your risk factors, and work with your doctors to address them.
And if you want more information about heart disease from First Coast Cardiovascular Institute, visit firstcoastcardio.com or call them 904-493-3333.